Well, this week, Joe Biden named the 13 members of his COVID-19 advisory board. And today I spoke with one of them. Dr. Michael Osterholm is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. And he told me that he won't be surprised if we soon see 200,000 new cases of COVID-19 a day here in the U.S.
Labor Day, that following Tuesday, we were at 23,000 cases reported that day. Today, we're 143,000 cases being reported, and that number is going up really quite quickly.
So how do we curtail the spread of COVID-19? Dr. Michael Osterholm says the response has to take into account the economy.
One of the things that is absolutely critical is linking together how can we incentivize the population to limit their exposures and at the same time hold individuals, businesses, governments, how can we hold them harmless? And that's where the federal government and a stimulus package absolutely has to be part of this response, and it has to be now.
Keeping schools open, he says, must be a top priority.
I'll just say straight up, do you want to have bars and restaurants, or do you want to have your schools open? Right now, I think opening schools is really important, and you're not going to open schools if you have widespread outbreaks in your community.
As we head into the holidays, he cautions that a lot of transmission occurs in family settings.
And we're trying to buy time until we get to the spring to get a vaccine and get your protection that way. You don't want to have to get it through illness. Don't be pressured into getting together for family events this year, but know that if you get a large family gathering together at a home, you today, given how much virus is out there, unfortunately run that real risk of transmitting that virus to a lot of people.
So when does he think that the pandemic will finally end? Well, he told me if the majority of the population gets vaccinated, he thinks that we can see big improvements coming in the second or third quarter of next year.